So the most common types of toe deformities that we see are mainly categorized into hammer toe, claw toe, and mallet toe. The hammer toe on the left-hand side is where you have a bending at the first knuckle within a lesser toe itself. The claw toe, you have a bending in both the knuckles within the toe itself, and the mallet toe is where you have a bending in the far knuckle close to the toenail of the toe itself. These toe deformities are mainly in regards to the lesser toe, that means the ones other than the big toe, and you get them in different conditions. Hammer toe most frequently affects the second toe and is commonly found in people who have a bunion or hallux valgus. And essentially the symptoms that people get are usually due to rubbing of the top of that toe against footwear, and also rubbing of the tip of the toe on footwear or the floor. Claw toe is more commonly seen affecting multiple lesser toes, and people who have claw toe can similarly get pain at the top of the toe as well as from the tip of the toe where it rubs against the floor. With the mallet toe, this is usually seen affecting the second toe as well, but can affect multiple other toes. And the symptoms from this tend to be due to rubbing at the tip of the toe, or as it's seen commonly in a longer second toe, across the nail as well, and sometimes getting associated nail changes. The other thing that the hammer and claw toe can present with is pain on the ball of the foot, due to the fact that the toe itself comes upwards. With those specific deformities, the bones on the underside of the ball of the foot can be exposed to increased pressure, causing pain underneath the ball of the foot. So in terms of the main causes of toe deformities, there are multiple factors that can lead to toe deformities, some that we can do something about and some that we can't. The ones that we can't do anything about are our genetic predispositions. However, this is multifactorial, so we can't say that it's all genetics, but we will commonly see people in the same family having similar appearance toes and consequently similar deformities in the toes. There are certain things, however, we can change, and that's the sort of footwear that we use. If we're using a lot of shoes that are narrow in the forefoot, that crowd the toes together, that can potentially lead to toe deformities, but certainly if we have toe deformities, it can lead to worsened symptoms. So by using a wider toe box, which is what the wider shoe on the right would be called, we're accommodating the deformities and leading to less symptoms. There are associations also with toe deformities with bunions, and it's quite common to initially start with a bunion, and as the bunion becomes more severe, it starts affecting the lesser toes, most commonly the second, which not only hammers, as in this case in the picture, causing soreness at the top of the second toe, but also you can get additional toes being involved as well. So the most effective treatment for a toe deformity will depend not only on the deformity itself, but also the patient it's attached to. Every treatment will be bespoke to not just the patient's foots, but also their general health, their activities, and what they like to do in life, and how the deformities are affecting them. Generally, however, it's worthwhile starting off with some non-operative treatments to help alleviate the symptoms. It's important to note that with toe deformities, there's very little evidence to suggest that preventative measures can influence the natural history or progression of the toe deformity. There are some theories and some evidence that a flat foot can contribute to certain toe deformities, but also a high arch foot can also contribute to some toe deformities as well. There's potentially a role in tightness of the top calf muscle called the gastrocnemius in contributing to increased pressure underneath the ball of the foot, which can be implicated in the development of toe deformities as well. So if one was to think about preventing toe deformities, stretching the calf muscle, wearing insoles if you have a flat foot particularly, can be very beneficial. Also, wearing shoes that are not too short, particularly if your second toe is longer, can prevent developing pain at the tip of the second toe and potentially a mallet toe. Once toe deformities have been established as well as beforehand, wearing shoes that have a wider fit can be more beneficial for the forefoot, both before and after toe deformities. Some treatments that can be tried once you have developed these could be in the form, besides wide-fitting shoes and avoiding narrow-fitting shoes, could be as simple as getting a silicone toe protector. In this case, it's been placed over the big toe, but this can be placed over the knuckle of the second toe or lesser toes, and there are even ones that serve as a toe sleeve that cover the tip of the toe if the pain is at the tip of one of the lesser toes or multiple lesser toes. When this is associated with a bunion, toe spacers and hallux valgus or bunion splints or pads can be helpful. However, one needs to be aware that this does take up space within the shoe and would require a wider fitting shoe, and it's not always comfortable. Finally, if this is associated with pain underneath the ball of the foot, there are sleeves with padding that can be purchased and used to give extra padding at the ball of the foot to help with symptoms. Hammer toe involves usually the second toe and sometimes the third as well. The reason why it happens is usually due to patients having some sort of reason for them to overload the second and other lesser toes. So we commonly see it in a bunion, the pictures of which I showed before, where essentially due to the deformity in the big toe, the tripod effect of the foot, which is based on the big toe, the little toe, and the heel forming a tripod for the body to stand on, is affected because the big toe is less able to perform its job with a bunion compared to when it's not without one. As a result of that, the lesser toe metatarsal head, so the long bones that lead to the lesser toes, are overloaded, and as a result of that can develop soft tissue problems that lead into loosening of the joint, potentially instability of the joint, and the subsequent lesser toe deformities. This is contributed to by an imbalance in the muscles that develops within the foot, and this process can be exacerbated by aging as well as other conditions such as inflammatory disorders or metabolic disorders, like rheumatoid arthritis being an example of one of them, and diabetes being an example of the other. As mentioned before, tightness in the top calf muscle can contribute to this and lead to a gradual weakening of the structures that hold the toe down, therefore allowing the process for the hammer toe to occur. And then due to the way that the longer and shorter muscles and tendons around the toes act, the toe assumes these typical positions of hammer toe, claw toe, or mallet toe based on the exact cause of them. Surgical intervention is not always required. As I mentioned before, there's not really much that can be done to prevent these sorts of deformities. Therefore, unfortunately, one assumes a reactive stance as opposed to a proactive stance, certainly surgically. So we treat the deformity based on the symptoms that are present and not for the appearance. as generally appearance, people are not usually satisfied with the results of surgery because it always ends up looking, quote, not normal. So we tend to deal surgically with whatever problems that they are, and that will depend on where the symptoms are coming from and the exact toe deformity. So for example, if there's pain on the top of the toe, there's one treatment, and the tip of the toe might be a similar or a different treatment. And a lot of it will be based on whether or not the deformity is flexible or fixed. If it is a flexible deformity, soft tissue procedures are an option. But if it is a fixed deformity, so we're unable to correct it when we do the assessments, then we will have to rely on more joint destructive procedures to deal with those. If the lesser toe deformity has an effect on the joint where the lesser toe joins the foot, then there will be a different set of options available during the surgical correction, which can involve shortening the long bones that lead to the lesser toes, and sometimes doing procedures within that joint. And due to the role of calf muscle tightness, it may be that calf muscle release can sometimes be needed to help with the symptoms. Finally, it's worthwhile mentioning that due to the crucial role of the big toe, it may not be possible to address the second toe deformity without addressing the bunion or the big toe, as if we were to try to bring the second toe, for example, down in between the space between the first and the third, we would not have it available to us unless we treat the bunion and move the big toe out of the way in a way.